Do patients who have had total knee arthroplasty who use non-pharmacological methods compared to patients who use only pharmacological methods have reduced post-operative pain? The purpose: to research whether patients who have had TKA achieve pain relief with the use of non-pharmacological methods of pain reduction. Non-pharmacological pain methods include guided imagery, listening to music, breathing techniques, and therapeutic touch, to name a few. Let's take a closer look to see what the search process and evidence has shown. Description of the practice problem. Pain is subjective. Total knee arthroplasty and other surgeries can cause a great deal of pain. Reducing postoperative pain is a top priority on a medical surgical unit. What costs are incurred from unrelieved surgical pain during a hospital stay? The clinical question. My search history was started by using the University at Buffalo's library site. I used both filtered and unfiltered searches. The filtered search allowed me to narrow down research articles by including inclusion and exclusion criteria. Unfiltered searches gave me a broad array of research articles. Search history and data extraction tables are shown on the following slides. Evidence has shown that by incorporating the use of non-pharmacological methods along with pharmacologic methods after surgery can indeed reduce postoperative pain and anxiety. As reported by Lynn, 2012, patients have less pain and anxiety with the incorporation of relaxation therapy after total knee arthroplasty. Comio and Steele-Moses, 2013, reported distraction from negative experiences can reduce pain and increase patient satisfaction. St. Charles Hospital should create a new pain management protocol for our total knee arthroplasty postoperative patients to incorporate the use of non-pharmacological techniques for pain management, which includes, but is not limited to, guided imagery, relaxation techniques, music, and therapeutic touch. The rationale for this recommendation is that the research shows that the use of non-pharmacological pain management methods reduce postoperative pain and increase patient satisfaction. IRB involvement. There is sufficient evidence to support the implementation of incorporating the use of non-pharmacological methods in conjunction with pharmacological methods to reduce postoperative pain. Method for implementing the protocol. To implement my change into practice, I have decided to use Cotter's model for change. This model is easy to follow and consists of 8 steps. Establishing urgency, creating a coalition, develop a vision, communicate that vision, empower action, generate short-term wins, consolidate gains and produce more, and anchoring approaches. By collecting data from my medical surgical unit, I have noticed that we do not incorporate any non-pharmacological methods to reduce post-operative pain. My data was collected from our flow sheets, which documents pain and pain reassessment using the 0 to 10 pain scale. We also document what methods were used to decrease pain. Out of 50 patient charts reviewed, only about 5 patients used other methods besides narcotics to reduce their pain. This created a sense of urgency and inquiry. After researching my PICO question and sifting through the literature, I created a team of fellow nurses, nurse supervisors, physicians, patient educator, and a nurse educator. By communicating the idea of using non-pharmacological methods to reduce pain by showing the evidence I have found we brainstormed how we could start using these methods in our everyday practice. With the power of evidence, the team came to the conclusion that offering our patients alternative methods for postoperative pain reduction would reduce the use of narcotics and the adverse effects that go along with their use. Empower action generates short-term wins, consolidating gains, producing more. Once we agreed to incorporate the new practice change, every member of the team added their part, and each one owned a piece of the new idea. We started small to see how our patients like having a choice to manage their pain. Some of the feedback we have received from our patients told us they do in fact like the use of other methods of pain reduction. To keep the momentum of the practice change going and instilling this new idea, to our nursing staff, we must come up with ways that will reinforce the change. Monthly meetings will tell us how well our change is doing and also help to see what needs improving. Posting data for all to see, such as graphs with increased patient satisfaction scores, will instill a sense of pride among the staff. My team and I have created an anonymous short questionnaire to be given to our patients prior to discharge that will ask these questions. Our flow sheets are also great for evaluating methods of pain reduction. By giving our staff new data which shows increased HCAHPS scores, that the practice change is working and our efforts were not wasted. We could post this in our break room or write out actually on the unit for everyone to see. We can offer incentives to staff, such as a reward program, to members of the team who excel in continually offering the practice change to our patients. We also can create a wall of thanks, which displays letters from patients and their families, administration, and other staff members acknowledging their efforts. Sustaining the change. Sustaining the efforts of practice change in healthcare organizations, such as those from the implementation of clinical practice guidelines, are noted to not only ensure that patients receive the best care possible, but also to ensure that investments made in knowledge acquisition and transfer are not wasted.